Today we are covering a topic of great significance, not only to where public health has really focused their efforts in recent years, but also in light of the what you may call racial injustice reckoning that is currently happening in our country. So I'm really excited to begin to uncover some of these issues with you today. Again, I will try to keep this brief and expect that you will go through this on your own time as well, and clicking on all of the links. There's a lot to discover here. So today we're talking about health disparities, mainly related to race and income, and our goal for health equity. Here's our first video. I have a series of short videos spread throughout this lecture, and I just want you to click on these. These are some really fun animated videos, less than 4 minutes, that really dive into issues related to health equity. And my question for you here to be pondering is, how does the concept of health equity, something that we began talking about at the beginning of the semester when we did our lecture on social determinants of health, and I showed you the photo of the children standing trying to watch a baseball game where they're standing at different heights, so people coming into life with different advantages and disadvantages. Then someone gives them all the same block to stand on, which obviously those who started with advantages are still going to be higher and get to see the baseball game over the fence, to the next kind of advancement, what we're looking for, which is giving people different heights of boxes to stand on so that we can all see over the fence. And then the final version of that is the idea that we are removing the fence entirely, and that we are removing systematic or systemic barriers that keep people disadvantaged in regards to health and other social determinants. So as we're reflecting back on this topic, kind of coming full circle in this course, I'm curious how this idea of health equity connects with your personal values or with your faith. Now, in these next series of slides, I'm just going to be showing graphs, and I'll let you pause and take a look at these on your own. But there are a lot of problems that we see regarding racial disparities in different aspects of healthcare. So this is looking at access to healthcare, the type of health insurance or uninsured that is happening among different populations. We can see that in adults, the disparity is especially great, and that Hispanics, this is amazing to me, that almost half of all Hispanic adults are uninsured. Now this data is a little old, but this is after the Affordable Care Act was passed. Childhood obesity is another topic that is just pretty incredible, the disparities there. This is hypertension-related mortality. Blacks have almost a 3 times difference in their death rate for hypertension-related issues. Maternal child outcomes. So we are one of the, supposed to be one of the greatest nations in the world in regards to how much we spend on healthcare and our technological advancements, and yet compared to other first world countries, as we've looked at, our maternal child outcomes fall far behind. And then when we look across our own populations in regards to different race and ethnicities, we still see that there are major, major disparities, especially for Black women and children. These are just a few examples of the many racial health disparities that are out there. Other recent ones that I've learned about are looking at CPR bystander rates, and that Black people are much less likely to have CPR performed on them by bystanders than whites. I've also looked at studies that have talked about CPR success rates in the hospitals. So even when we're looking at not bystanders, but healthcare providers, and that Blacks fare much worse with CPR survival than whites do in hospitals. There's just many more. You can just go digging. So my question to you is, why do you think these disparities exist? Is it policy issues? Do we need to beef up our policies? Is it cultural attitudes? That definitely is pervasive with the bystander CPR studies. Is it that we behave differently, we eat differently, we exercise differently, and it's individual health behaviors certainly plays a role? Are there institutional barriers that we should be looking at? And so I have another video for you from this same animated series, Health Equity and Income. How have you seen this play out in your clinical practice is what my question is to you here. Something to think about as you watch this video. And then what causes the problem? So I'm not going to go into detail on this. This is all, I have the citation at the bottom, but this is your required article reading for the week. This is from Dr. David Williams and his colleague, who he is also the one who did the amazing TED Talk that you're watching this week. I saw him as a keynote speaker recently at our National American Public Health Association conference. It was in San Diego 2 years ago in the fall of 2018. And he was a phenomenal speaker and just has some very compelling research to show how racism affects health. So I have just bullet pointed some of those problems for you that he has talked about in his TED Talk and in his research article here. Please click on these links where you can kind of find a little more details about these things. USA Leap here is a fabulous resource. It's a new collaborative project, data project that just came out within the last year. And what you can do is type in your zip code, find out your life expectancy, and look at other factors related to social determinants of health in your zip code. Another short video, please click on here. This is health equity and zip code. So all these different animated videos are attaching health equity to different social determinants. And if you remember what Dr. Manchanda said, he was the first TED Talk we watched in our social determinants of health section. He said that your zip code matters more than your genetic code. And to illustrate this, I have a couple graphs here just to show you in one urban area alone, there is a 14-year life expectancy gap. Now this is comparing downtown Phoenix to Scottsdale. So from 71 years to 85 years, all in the same urban area. I used to live in Phoenix, and I can tell you that this makes a lot of sense to me based on what I knew about these different neighborhoods. In Richmond, Virginia, so we're looking out over the East Coast, in one urban area, a 20-year gap depending on your zip code. Pretty phenomenal. This is another short video, an animated one that kind of explains systemic racism in 4 minutes. I think it's incredibly informative and really helps us to understand some of these structural issues and institutional issues that really propagate these disparities related to income and race. So more of what causes the problem. Again, these are things straight from Dr. Williams' article. And so I'll let you read those on your own. I think something that's incredibly important, he talks about this in his TED Talk, I've bolded it here. If we were to eliminate residential segregation, that we would completely erase Black-white differences in earnings, so in income, in high school graduation rates, in unemployment, and in the state of single motherhood. That is a phenomenal claim that he makes, something worthy of taking deep consideration and looking at what residential segregation has done to a whole variety of social determinants of health. And so here's his TED Talk. It's linked here. It's also linked in your Canvas page. And I have a handout that might be helpful for you to take notes on. Just note that you will have to pause the video in order to fill out the entire handout because he talks quickly and provides a lot of data as he goes. So I think it's important for us to kind of break this down a little bit. If you are not familiar with the term implicit bias, this is something that Dr. Williams refers to frequently. It's important to talk about that here because we all hold biases, and there are biases that are held within our institutions, within our structures and systems. And it's really important to begin to become aware of those things so that we can be a part of the solution and not the problem. So an individual bias is just a preconceived notion that we have on our own. I also want to just make this really clear that an individual bias does not need to be conscious to be there. I've had some really difficult conversations about race recently with my own family of origin, and my mother's understanding of racism and bias was that is when you have a conscious feeling of hate or disgust for someone that's different from you. And I said, yeah, that's an obvious example of racism or bias, but there are much more subtle ones that are usually occurring that we often are not aware of. Giving preferential treatment or having extra caution towards one race or group that we just are used to doing and haven't acknowledged or recognized in ourselves. And that is where a lot of the danger comes in. Institutional biases, where there are policies or procedures that are in place where often they're unintentionally or inadvertently giving certain people groups better treatment. And then there's the structural or systematic bias, where we have a history and a current reality of institutional racism that just continues to need to be broken down. We see this in all of our dialogue about law enforcement, but we know that this exists. There's plenty of studies to show this exists in healthcare systems as well, in our education system. It's implicit in a lot of different areas. And so what's important to also tease out is implicit bias versus explicit bias. So the example I gave to you from my mom is an example of just that. She was referring to explicit bias, and I say there's a lot to know about implicit bias as well. So I have this kind of laid out for you here, and I have the citation below as to where I got a lot of this information. And here's more to talk about with implicit bias, that often it's not accessible through introspection. And we can't just say, well, I've done some reflection and I've looked within and I don't have any bias. I don't have any racism within me. Often these things take a lot of work and conversations with those who have different stories or perspectives in us in order to call it out, and that we often cannot understand it by ourselves alone. We get a lot of it from our cultural upbringing, from our family of origin. We get a lot of it from our media, news programming. And so what is the best way to attempt to uncover these implicit biases, internalized racism? It's to incorporate broad perspectives from diverse people into our worlds. Now, I have it listed here as like incorporating perspectives of a broadly diverse team. So if you're in a more of an employment setting, you would want to create multiple perspectives on your team as you're working towards a unified goal. But in your own personal journey, I would just highly recommend that you become intentional about seeking diverse perspectives, whether it's feeds on Instagram or Facebook that come from people of different backgrounds and races and ethnicities, or genders even. Whether it's books that you're reading, this is something I've tried to become more intentional about, is reading books from people of different race and ethnic backgrounds, news sources, whatever it may be, but just learning and listening to the stories of others who have experienced life so differently from you can really help to uncover some of the implicit bias that we hold. This is a fabulous slide from PolicyLink, a health advocacy organization. My sister actually used to work for them, side note. And this is on the left is what we don't want that often happens, where we have tons of these inequities in racial groups, and that then they have these really bad health outcomes because their inequities are high and their community assets are low, right? And so the bottom is kind of where it's showing that they have low community assets, things like institutional racism, not good schools, segregation, living closer to environmental toxins. We know that racial groups, especially Blacks, are often at much higher, live in neighborhoods that are much more exposed to environmental toxins. This is another huge issue, environmental racism that we could go into. So those are all the things that we need to bring equity towards and provide more resources so that there are not also additional disparities that then cause these health outcomes on the top. And so we want to move towards the right of the screen where inequities are low. So if we're looking at the roots, so we're actually providing good things like quality schools, access to healthy foods, health insurance, access to health care, so that then we don't have this overabundance of health outcomes that are negative and inequities that are high. So if you're a visual learner, maybe this is helpful to you. So my last slide refers to a health equity tool. What would a health equity toolkit for nurses look like? I have linked one for you. This is part of your discussion board assignment this week. I really want you to dive into looking at this, identifying a few of the things that you can work on to do differently regarding your own perspectives about health equity, health disparities, internalized racism, or implicit racism and how we can move to be better in this area. So I look forward to your discussion this week.